Hello, this is Rashid Dash, and I am presenting today on mental illness and mental health conditions. Mental illness is a loose term that doesn't specify what we mean when we use it, however, it's used extensively. Mental health conditions becomes a more discrete, more well-defined criteria to meet to have mental health condition that could be or could be not the focus of treatment. Before I get more into that, I like to point out that when I'm talking about mental illness and mental health conditions, I am excluding anything that is caused by medical illness or substance abuse, as those will be separated and discussed later. As far as mental health illness, there are some myths about what causes it and why it happens and whether it's a weakness or caused by outside factors. We will discuss at length in the next two sessions the precipitants and causes of mental illness. However, it's important to know that mental illness could happen at any age with or without stressors. But it's also important to know some of it is time limited and might be resolved just by letting the time pass. Like if you get depression following the death of somebody or a loss, then grief and talking to family and getting support might be enough to resolve that. In addition, you could have condition that happens quickly and resolves quickly, sometimes with treatment or without treatment. Even when we use the term psychosis, which is the most severe form of a mental health condition, that psychosis could be temporary and situational or reactive and might resolve spontaneously. So it's not always that when someone get diagnosed with a mental health condition that it's lifelong or that their progress from it could not be complete remission of the symptoms. However, when we get into the more serious persistent mental illness, we call it, for conditions that range from bipolar to schizophrenia to depression to anxiety to OCD and many others, there are very well defined criteria that we use the DSM 5 right now that people have to meet definitions and timeline to be diagnosed with those conditions and to receive the appropriate treatment. Not only that, but some people will have comorbid conditions and have more than one condition at the same time. It is important to know that no matter what the condition is, it should not be incompatible with a normal functioning and normal life. And what we mean by normal life is one complete or semi complete remission of symptoms, not getting into crises that require emergency room intervention or hospitalization, and having normal functioning in work, relationships, and general self reliance and feeling content and comfortable and having normal functions of eating and sleep, etc. I hope this is helpful, and we will meet again to talk about causes of mental illness in the next session. Thank you for your listening.